Good afternoon, and thank you for joining us for the 35th webinar of the HFRC, the Healthy Flint Research Coordinating Center, Flint Corona, excuse me, the Flint Community Webinar on Coronavirus. We are so excited that you're here today. I'm your moderator, Yvonne Lewis. I'm the co-director of the Healthy Flint Research Coordinating Center's Community Core. And you can see the other hats that I'm wearing here today. But we're so thankful that you've joined us. We have a wonderful, wonderful webinar prepared for you today. So we want to encourage you to stay with us all the way through the webinar. As we are proceeding through this webinar today, I want you to know that we have a number of community partners that have been with us for this 35 weeks, and we are looking forward to their continued involvement with the webinar. I want to remind you also that you can either plug your questions into the Q&A if you're here with us on the webinar, but for those of you that have joined us by YouTube, we want you to know that you can send your questions in to us at info@hfrcc.org, or you can give us a call at 810-835-2130. If you're joining us for the first time, I want you to know that the Healthy Flint Research Coordinating Center is a multi-collaborative. We have community partners. We have the University of Michigan Flint, University of Michigan Ann Arbor, and Michigan State University, who have joined together to make sure that this webinar is available to you. Our community-based partners are represented by the National Center for African American Health Consciousness, with other community members, as well as the community-based organizations, Community Ethics Review Board. I am excited that we have so many partners that have joined us over these 35 weeks, from our hospital systems, philanthropy, our community foundation. We have the Michigan Public Health Institute has been here with us. City of Flint is here with us regularly, along with the Genesee County Health Department, Genesee Health Plan, and so many, many partners. As you can see, if you're listening, if you're not able to see this banner, I want to encourage you to go to our YouTube channel and look at this wonderful banner that expresses a kind of cooperation that we have in the City of Flint and Genesee County to ensure that we bring the best possible information to you and our community. Today, as I mentioned to you, it's an exceptionally powerful day because we have with us representatives from the hospital. We want you to know we heard you. And many of you said, we want to know what's going on at hospitals. How do we engage at our hospitals? And we have two hospital representatives, both working at the emergency rooms of the hospitals. So we're going to have them on first, because they may have to leave us and get back to work. First up is Dr. Michael Tupper. He's been on with us before, early on in the webinars when we were first in this crisis, even out doing community testing. Dr. Tupper, would you please give us some insights? What's going on at Hurley in the midst of this rise in coronavirus cases here in Genesee County?
Yeah, thanks, Yvonne. So as everyone is aware, we are in the midst of widespread community spread really across the state and across the country. And so our experience, both in the emergency department and in the hospital, is that we are seeing increases in COVID-19 cases amongst our patients, and our hospitalizations are increasing. Now there's a lot of talk about hospital capacity, and we still have hospital capacity. I do want to point that out to care for the people that need to seek care. But the cases are increasing, and the number of cases that we have tripled in the past month or so. So it's really important for everyone in the community to do the things that we know are effective in preventing the spread of COVID-19. And that includes obviously wearing masks, socially distancing, washing their hands, and really minimizing travel, social contacts to what is absolutely necessary. In the hospitals, we have continued to implement procedures that keep people safe. And so the people that need to seek care, both for COVID-19 and for other emergent medical conditions, should come to the hospital, and we're going to treat you well and take care of you and do what needs to be done. But it's really important for everyone to practice the basics and really bunker down, so to speak, because we are getting back into the surges that we saw back earlier this year.
Thank you, Dr. Tucker. I see you're busy. They're knocking on your door already. So we'll understand if you have to leave us, but thank you. I want our participants to know you can put questions in the queue all during the webinar so we can be sure to answer them for you. We also have with us for the first time this week is Jason West from Ascension Genesee Hospital. And Jason is the Director of Emergency Trauma in Services and Education at Genesee. And so we're going to ask him to give us an update for Genesee.
Yes, thank you, Yvonne. I really appreciate you having me on today to speak about some of the really great things that we're doing here at Ascension. And you heard Dr. Tupper talk about some other initiatives that are going on just throughout our community to really support all of you. So the first thing that I just want to mirror that Dr. Tupper said is please don't delay care. All of our sites are really stepping up to make sure that, despite the challenges that we have with COVID-19, that we're still able to care for all of you in the community that have general medical problems. So if you or a loved one are experiencing any signs or symptoms of a heart attack, a stroke, any other medical emergency, please, please, please do not delay care. We are absolutely able to care for you. We're able to care for you safely. And so that's one of the biggest things that we really want the community to understand is that we're here for you and we can still care for you. As you can see, one of the new initiatives through Ascension is this How Are You Feeling Today initiative. And that's really just to check in with your coworkers, check in with your family, friends, neighbors, see how they're feeling, see if something's off. If there is that you notice, really encourage them to seek care, whether it's through their primary physician, through an urgent care, or through an emergency department. So next, I kind of want to go into what you can expect if you come to our hospital to seek care. So I want to go through a little bit of our intake process. So when you present to Ascension Genesee, the first thing that will happen is you'll meet one of our screeners. So our screener will take your temperature. They'll ask you a few simple screening questions looking for COVID-19 symptoms. They'll provide everyone with a medical grade mask. We'll then have you step up to our registration area where we'll get you registered. We do have a new secondary process for registration where we can actually do it all through your phone so that you don't have to have face-to-face contact with registration personnel if you don't want. But if you do, we still have the traditional process. We also are running a split flow so that we have areas for our standard patients who are presenting with non-COVID-19 symptoms, and then a separate process for patients that are presenting with COVID-19 symptoms. Again, that's all separate, and we do it in a discreet way so that we maintain your privacy. In addition to that, we do want to discuss what our current visitor policy is. Right now, we are allowing one visitor for patients that are seeking care here, with the exception of anyone who does have COVID-19 symptoms or is suspected for COVID-19. With that being said, we know how important it is that you have someone close by that is a loved one or a trusted individual. So we do have tablets actually that are linked up with a virtual feed so that those loved ones, even though they may not be able to be with you in the hospital, can still get information from our care team and can still communicate with you and everyone else here at the hospital. And the reason that we do that is we just want to kind of limit the number of people that are coming into our hospital for the safety of the patients that are already here, for the safety of our staff, and then of course for you who are coming in for your medical emergency. Some other options that we have too, just to improve your access to care, is we do have virtual visits that are available, and we also have online scheduling. You can schedule an online visit, or you can go online and schedule a visit to our ED at the link there that's shown. It's ascensionhealth.inquicker.com. That will use your local location to automatically display primary care physicians, urgent cares, and emergency departments that are currently accepting appointments. or you can put in a custom location and it will repopulate with a care clinic near you where you can be seen. And then in addition to that, we also have online care through our ascensiononlinecare.org. And that's actually a telehealth visit that you can do remotely if you have access to that. But again, like I said earlier, you still have access to all of our standard treatment options through the emergency department. And please, please, please take care of yourself, take care of your loved ones, and follow those recommendations that are out there. That's all I have for you. Thank you.
Thank you, Jason. And before either of you have to leave, Dr. Tupper or Jason, just a quick question. Do people have to, are you recommending that appointments are made if persons need to come into an emergency, or how do they, if their loved one is already in the emergency and they want to see them, what do you recommend they do in terms of communicating that, their desire to visit? Start with you, Jason.
So what I would recommend is for anyone, so you can absolutely make an appointment, especially if you're starting to feel COVID symptoms or you have signs. We always appreciate a heads up. It really helps us to just kind of streamline that process. But again, we do have the split flow in place. As far as if you have any questions about visitation, I'd encourage you to coordinate with, if it's a loved one, just ask them, find out where they're located. Contact the main hospital number and just kind of see what the visitation is at that time.
Thank you. And Michael, what about at Hurley? Is it pretty much the same process?
Yeah, it's overall similar. So ultimately, if you need to seek emergency care, we want you to come in and seek emergency care. Right at the moment you hit the door, you're going to be asked screening questions with regards to symptoms of COVID-19, exposures to COVID-19. Have you tested positive for COVID-19? And then it's a similar process of cohorting patients separately to minimize any cross exposures. So we currently don't have a call ahead process for the emergency department. Certainly, if you're seeking care in one of our other outpatient clinics, yes, a call ahead for an appointment for usual scheduling is entirely appropriate. All of our outpatient clinics have telehealth options, meaning that really you call, when you set up your appointment, you can be offered whether you want a in-person or virtual visit. And a lot of those screening processes, if you don't feel that you have an emergent condition that needs care right away, can be completed through a telehealth encounter and then referred to testing as appropriate.
All right, thank you so much. We want to appreciate you both for being on with us. And again, as I said, we understand if you have to leave, but if those persons or those of you that are listening and watching have questions, put them in the queue. We might have 5 more minutes of their time as panelists, and I'm sure they'll be happy to answer those questions for you. Thank you again so much. Now, something exciting happened this past week, and we talked to you a little bit about this before. Many questions about the data. We've been talking about how there was some great inequities with respect to how the virus was impacting our community. Dr. Deborah Forholden, of course, has been on with us, and she's all over the nation talking about these things, but she has some exciting news for us here in Flint, Genesee County. Dr. Deborah.
Okay, great. And I'm the slide runner for today, so forgive me, everybody, for the little slide mishaps. We made tremendous progress on racial disparities in COVID in Flint. And I just want to take one quick second, and I want to tip my hat to our fabulous, wonderful health department. Our health commissioner, health officer, John McKellar, just retired, but we've got a world-class epidemiologist, Dr. Suzanne Cooper. You're going to hear from her. The Greater Flint Health Coalition, the Community Foundation, the hospitals, all of our amazing partners, we mounted up. And I read a newspaper article. There are only 6 states who've made positive strides in COVID. And Michigan is the only state that I know of that has actually eliminated health disparities in COVID. We were one of the first states to report on the data to say, we have a problem. And then not only did we say we have a problem, we mounted solutions to address those problems, both at the state and at the local level. So I just want to tip my hat to all of the wonderful leaders in our community and all of the residents and people who rolled up their sleeves and did the work. So here's what the data tell us. African Americans are 60% of Flint residents. When the pandemic started and we were at our peaks in March, African Americans, even though we were only 60% of the population, we were 85% of the cases and 91% of the deaths in March. We look at those numbers in September. We have the data from October. We have a data user agreement in place now with the health department. We're hoping that and real clear that we're going to make sure that the community gets data that they need in a way that is very digestible for them and that is actionable for them. Where we are now, September, and the numbers in October look very similar. We are now 38% of the cases and 50% of the deaths. We're actually underrepresented. We have literally eliminated the racial disparities in COVID in the city of Flint. It is a testament to our strength and to our attention to these very important social justice issues as it relates to health and wellness. I'm an epidemiologist. My fabulous colleague, Dr. Rick Sadler, who is now a full-blown card-carrying member of the Public Health Club, recent graduate of the Bloomberg American Health Initiative with his master's in public health. Our native geographer produced all of these graphics. This just shows the relative risk of COVID infection by race in Genesee County and in Flint. And as you can see, if you look early in the pandemic, we had about a 7.5 times increase in the risk of COVID infection. Sometime around all of these different interventions have been mounted, including rollout of resources from the Greater Flint Urgent Relief Fund, including barrier-free access to testing, national programs like enhanced unemployment. Many of these things helped us to turn the tides on this. And as you can see here, somewhere around between July 5th and July 12th, we solved the problem. And we have been operating without health disparities, racial disparities in COVID-19 since. And you can see that continues even as early as the first week of November. Anything below 1 means it's sort of level playing ground. So again, tipping my hat to our fabulous colleagues who did the work. If you compare Flint and Genesee County, what you'll see is early in the pandemic, Flint is the blue line. Flint had a much higher rate. This is a rate, it's not the total numbers. This is the number of cases per 100,000 in our population. Flint had a substantially higher case rate than we saw in the overall county. What we've seen is now the efforts and the interventions that have been mounted, we have dropped that down, and you can see now that Flint has a substantially lower case rate than Genesee County. It doesn't mean that we're out of harm's way, because if you notice, somewhere around August, September, the rates started to go up in both places, but the rate in Genesee County has gone up substantially higher than it has in Flint. So I just continue to encourage people. I feel like I sound like a broken record. We've got to honor the protocols. We've got great citywide strategies. I know people didn't like it. They didn't like the curfew. They didn't like the mask mandate and all those things. But those are the things that I believe have helped us to flatten the curve. So we're still dealing with this pandemic. We're very much in the throes of it, but it looks like we're making progress in the right direction. Same thing holds true when we look at the racial comparisons. African Americans started off, that's the blue line, substantially higher. We can see now that that number has gone down. We've leveled the playing field. Now we just have to deal with our community writ large. Same thing holds true when you look at deaths. If you compare Flint to Genesee County actually started off with a substantially higher death rate. We've now brought that down. So I think the work, and I'm so grateful for our previous presenters who've come on, and we know Dr. Tupper is like he's everybody's ED doc. If I ever had to go to the ED, I'd be happy to see Dr. Tupper. But we've made significant strides in how we treat the sickest among us. And so the death rate is an area where we do have a victory. For people who are becoming cases, we're doing a lot better job at keeping those people alive. Similarly, we've eliminated the disparities, the death disparities that you see in death. As you see here, the rate for African Americans was off the chart. Look at how steep that curve is early in the pandemic in March. And somewhere around April, May, we started to bring that down. And now those rates remain equally low for African Americans and whites. The last thing I want to point to, Yvonne, and thank you for giving me a chance to just share a little bit about the data. I welcome the feedback. We want to give data to people in a way that, again, makes sense to them and is actionable. We've got some geographic variation. If you look within the city of Flint, you can see we've got our highest clusters of cases. Again, our fabulous Flint-based, Flint native geographer, Rick Sadler, produced these maps for us. He's got his team ready and at the wait to do this every week and give us what we need to make good decisions to protect ourselves and our family. We've got some hot spots that still persist in North Flint, specifically in the township, some hot spots in Grand Blanc and in other areas surrounding the community. We can't possibly deal with all of that right now. What I can say is we will be informed by the data. We will be informed by people's experiences, and we are doing our very best to implement solutions that match the problems. But I just want to acknowledge all of our great folks, including the people that come here and become credible messengers to let our community know what they got to do to stay safe. But we've turned a corner on the disparities. Now we just got to continue to flatten the curve.
Thank you so much, Dr. Deborah. And as we talk about this work that we're doing, this is brought to you by the Healthy Flint Research Coordinating Center. And our goal with the center is to really have the opportunity to have community equally engaged in research as we do our academic partners. And so this is a real example of how the research can make a difference for us in the community, and all the necessary partners come together to get that data to us. So thank you again, Dr. Deborah. Today is just so exciting. We've got questions in the queue. Please keep putting those questions in the queue. Again, we want to thank the hospitals for coming on today, because they're where we go when we're the sickest of the sick. And if we can reduce the number of us that are sick, we can improve the overall health and well-being of our community. And that brings us to have a conversation with the Chief Health Officer Advisor of the City of Flint, Dr. Reynolds. You're ready to share with us? I see you sitting up at attention. Dr. Reynolds, welcome.
Well, good afternoon, friends and neighbors. I thank you all, because we made the plans at the city, the county, and the state level, but our community listened. So I appreciate it. But if you look at my background, you see a storm is coming up. We are still on the roller coaster. And in order to continue our efforts to reduce the destruction from COVID on our community, there are things that we need to do, especially with the holiday season coming. Number one, refill your meds, okay? You don't want to go through the holiday season and your provider's office is closed. Number two, check your insurance coverage. Make sure you know what your insurance is, who your doctors or your clinics are, where they're located, and what hospitals they use. And then we talk about preparation. Okay, I'm the son of a nurse, and so I'm going to lay it out to you the way she would lay it out to you. Have medications for fever. That's Tylenol, Motrin, ibuprofen. Make sure you have some on hand at home. And if we experience what we did in March, it was no longer on the shelves. It was behind the cashier's register in some of the drugstore chains. And I'm telling you this so that you have it available. Make sure you have a working thermometer. Make sure you have masks, gloves. And if you really want something for Christmas, tell your family you want a pulse oximeter. They're about $20 to $25. You slip it over your finger and it tells you if you are getting adequate oxygenation. So please get ready, because we are back in the storm. And then get your flu shot. And if you haven't been tested for COVID, get tested. There's so many ways you can do it. Get tested. If you're living, breathing, if you have a fever or symptoms, or you're taking care of someone with symptoms, or if you leave your house, or if someone comes into your house, make sure you are tested so you at least know your status. And even though you get tested, put on your mask and keep on your mask. And then make some serious plans for holidays. And I'll use the expression, you can't let lottie-dottie and everybody in your house. Okay, so seriously consider Do I need to have people coming from outside my household into my household, especially if they haven't done the 14-day quarantine before Thanksgiving, and 14 days started yesterday? So you must have a plan, and I recommend, if they're not in your household now, don't let them in or don't let them stay for Thanksgiving.
Well, thank you, Dr. Reynolds. I know you probably got some more on your list, but you're going to come back next week, because next week we're going to be talking about some more about safety for the holidays and what that plan should look like. So thank you so much.
And look out, my name is Scrooge, so I'm going to get real strict.
Okay. All right. Well, we're gonna brace ourselves for the storm that's coming from Dr. Reynolds. So, along with Dr. Reynolds at the city, thank you, Dr. Reynolds, is Billy Mitchell, and Billy Mitchell is working so hard to make sure that we're all getting the kind of information and help that we need as the manager of public health for the city of Flint. So, Billy, I know you've got a couple of things that you want to share with us today.
Good afternoon, Flint. Thank you for having me today. So I want to go right into opt-in forms. And so you do have until November 19th, 2020 to get your opt-in forms in to row to get your pipes checked to see if they're lead or galvanized. You can do that a couple of ways. You can go on our website at www.cityofflint.com. You can even call me, Billy Mitchell, at 810-237-2044, or you can contact Row. Their number is on the screen, and it's 810-410-1133. You can also use our number at 810-410-2020 to get your water restored. So if you have your water off, or if you know someone who does not have water coming into their home, they can call 810-410-2020 and get their water restored free of charge. Again, you have until the 19th to get your opt-in form in, and water restoration is going on for the continuation of this year.
Well, thank you, Billy. And I know we wonder why right in the heart of this, we're talking about water, because our water crisis is, I don't even want to call it crisis. Our water dilemma is continuing, and we want to make sure that everybody has the information that they need with respect to that. So thank you for that update, Billy. I want to go quickly now and let's talk about what's happening at the state of Michigan. Gary Jones, who has been a great partner with us representing the governor's office, is on a well-deserved and well-needed vacation day. But we do have an announcement for you. Many of you remember a few weeks ago that the governor was going to establish a special committee, or advisory council, the Black Leadership Advisory Council. And we have 2 representatives from the city of Flint out of almost 700 applicants. There were 16 slots, and 2 of them belong to residents of Flint. So we want to congratulate and thank Christopher Bertley, who is the son of Nate Bertley, and Teresa Roach. They are our representatives on that advisory council. Here's the thing that Gary wanted me to point out to the residents of Flint, Genesee County. There were only 16 slots, and Flint has 2 of them. The other city that has multiple seats is Detroit, and we know how large Detroit is. But for us to have 2 representatives, that speaks well for our community, and we want to make sure that you know Christopher Bertley and Teresa Roach. Be sure, if you have an opportunity, to talk with them and help them be well able to represent us at that table for the advisory council. So when you see them, give them some good kudos and thank you for their work that they've already done in the city, and we're going to thank them in advance for what they will do. I want to remind you one more time, you have opportunity to put some questions in the queue, because the next conversation we have may alert you to some things that you've been thinking about that you want to ask. While we're going to our next, there are a couple of questions in the queue, and Ashley says, and if we don't have the persons on the line to answer these, we will. But Billy, this was to you. If you owe on your taxes, can you still have your water restored? I'm just going to open that up for you real quick, Billy, to answer that question.
Absolutely. You can still have your water restored no matter if you have a high water bill or you owe property taxes. Yes.
Great. Thank you. A couple of questions we're going to get to later on, but Dr. Deborah is so great. People are thankful for the disparities information. The question to the panel, and ask you to put in, if you have a need for volunteers, the question says, please, will you name your agency's strongest needs for volunteers? So there are some people out there that want to volunteer to help us continue to do this work. I look forward to connecting with them. If you can connect with them in the chat. So what's happening in Flint, Genesee County? Suzanne Kupel and Kimberly Van Slyght are both with us today. And so gonna ask Kimberly right quick. We talked a little bit about this whole notion of getting out of isolation and all of that. And you can't get out of isolation, but you can test out of quarantine. Did I get it right?
Nope. Turn it around.
Right,
Flip it up.
there you go.
Flip it up, turn around. You cannot test out of quarantine. You can test out of isolation if you were symptomatic and you go to get a test and the test is negative and the doctor is able to diagnose you with another issue, such as allergies, strep throat, etc. So yep, if you're quarantined, it's because you have been in close contact with an individual who has tested positive, and you need to be in quarantine for 14 days because that's how long it takes for that to incubate in your system and potentially grow into an infection that causes you to be contagious.
Thank you, Kimberly. We can't talk about that enough because in this increasing time of positive cases, the whole notion of being able to break this chain of transmission is very important. And we kept that slide up just to give a quick reminder to our participants every week that we want to break the chain. So you can give us a quick update on the contact tracing activities that are happening. And we want to encourage people to answer that phone.
Yep, we want you to continue to answer the phone. Currently, our numbers are so high that we are having a very difficult time getting past our vulnerable populations. And our vulnerable populations right now are people that have to do with schools, so the students and the teachers in schools, and our long-term care facilities and other congregate living type situations such as the jails or long assisted living and our adult foster care. So those are what we're focusing on currently. We are in the process, and I'm so thankful for all of these webinars because we are in the process of trying to get that information out to people so that they know the difference between isolation and quarantine, and they know when they need to do that, even if they haven't received a call from us yet, because I will tell you, our calls to the general population are lagging because we have to focus so much on the vulnerable populations first.
Thank you, Kimberly. And I know it's a lot of work, but we appreciate the work that you're doing, and you're building a larger team to be able to help us in the community. Now, Suzanne Kupel, who's been here to tell us all of the bigger facts, or the larger facts about what's happening at the health department, as well as some conversations about the testing sites, bring us up to speed. And you know, I have a special question for you to answer today. So I'm gonna turn it over to you now, Suzanne.
All right. So as of yesterday, we posted 8,202 positive COVID-19 test results with 334 deaths. So we've seen a significant growth in the number of positive cases that we have seen since the Labor Day timeframe. And again, we are now seeing deaths. We are not seeing the case fatality rate that we did at the beginning of the pandemic. Recognizes Dr. Tupper and Dr. West had said that we are finding ways to better treat people who have COVID-19. But our challenge here is that our positivity rate is 13.8%. So Yvonne asked me, what does that mean? What does that positivity rate mean? So the World Health Organization set some standards for consideration about community spread and when to start pulling back when we're seeing widespread community spread of COVID-19. And their recommendation is 5% to start thinking about ways that we can kind of pull back a little bit, be more conservative about our interactions. And the positivity rate is basically the number of people who get tested, who test positive for COVID-19. Now, prior to the Labor Day time frame, we were seeing that positivity rate about 2.4. It's 13.8 now. So we recognize we're seeing widespread community transmission of COVID-19. And again, you've heard from others today, and I'm going to reinforce, this is the time to wear your mask. The CDC recently provided some additional information about the value of wearing a mask and how it's 70% protective of you when you are out and about. We want to make sure you're wearing your mask, you're appropriately social distancing, you're washing your hands frequently. Washing your hands is the best protection against disease that we know. We also can use hand sanitizers that are 60% or more alcohol to help prevent the spread of the COVID-19 virus. The other key thing is that when you get tested, as Dr. Reynolds likes to remind us, it's not a one and done. That if you are a person who's in the community, an essential worker, that you periodically get tested. We've talked a little bit about when to get tested. So just a reminder that if you're exposed to someone, it takes a few days, 5 to 7 days, to build up the virus in your system so that the test can detect it. So you don't want to get tested right away once you've had that exposure. You want to wait a few days. And you've heard Kim talk about quarantine and isolation. So let's remind everyone that we have 3 community testing sites. So Dr. Deborah talked a little bit about addressing disparity in our community. Recognize that this summer we were able to bring on board 3 community testing sites that will be with us for a while. Word of Life Church, Bethel United Methodist Church, and Macedonia Baptist Church. Those 3 locations are available for testing. Remember, they are doing the oral swab, so you don't want to eat, drink, chew gum, or use tobacco products 30 minutes prior to your visit. Again, they strongly encourage making an appointment. And as we're seeing the number of people requesting tests grow, I think that's really important. But if you do go and you go on site without an appointment, they will make every effort to get you tested and take care of you. Remember, all of these locations have had a site visit, so they are ADA compliant. If anyone has a challenge with English as a second language, or deaf and hard of hearing community, or any other issue that they need assistance with, these particular locations can accommodate you. In addition, the Greater Flint Health Coalition CHAP program is providing additional assistance for anyone who needs referral for other types of help. And again, we're very fortunate that we have additional locations in our community that can do testing. Now, these either do the nasal pharyngeal swab or they do a nasal swab. So we have the Walgreens in Flint on Davison Road. We have the Rite Aid in Swartz Creek and the Rite Aid on Clio Road in Flint. And we have Hamilton Community Health Network at their North Point Clinic and at the Burton Fire Station at the corner of Bristol and South Saginaw. I'm going to remind everybody that this is the time to get a flu shot. If you have not already gotten one, please get a flu shot this season. Recognize we have 2 respiratory illnesses in our community at the same time. We have COVID-19 and we have influenza. So we want to make sure that you are protecting your health, reducing your risk of getting influenza, and again, reducing the risk of serious complications from influenza, so we keep our emergencies rooms available for others who have emergent issues. The other thing I want to remind you is the same thing that Dr. Reynolds reminded you. This is the time to talk with your family and friends. Come up with a plan of how you are going to celebrate the holidays. And there are many other options, including Zoom. There's other ways in which you can safely celebrate with your family and friends. So have those candid conversations, create a plan, follow that plan. Again, recognize that we have testing available in our community. We have all of those resources with our primary care physicians and other healthcare resources. If you have the need for assistance in locating a medical home, we have the Genesee Health Plan, Genesee Health Systems, and the chat program at the Greater Flint Health Coalition, who can assist you in finding a medical home. Take care of your physical health and your mental health. That includes getting all of your immunizations and making sure that you get your regular health screenings.
Thank you, Suzanne, and you'll be back with us next week as well as we talk about these plans for the holiday. You gave us some good tips for today, but we want to make sure that our listeners get them again. So please join us next week as well. We're thankful that we have not only the state represented by represented from the governor's office, but also the Michigan Department of Health and Human Services. Sharonda Griggs contacted me. She could not be on, but we have a couple of really important tips with you as it relates to the testing sites. And one is that there is going to be some holiday time for, let me back up. First of all, there's a new number. Many of you that went to the local community testing sites at the 3 locations that Suzanne mentioned earlier, Word of Life, Bethel United Methodist, and Macedonia, were given a phone number. That number is now different. They got a new contractor for the phone contacts last week. And so I want to let you know what that number is right here on the screen. We have it. It is an 800, toll-free number, 855-873-6996. That toll-free number is 855-873-6996. Or local number, it's area code 313-284-7940, area code 313-284-7940. So they also have an email address, covid19help@hanumg.com. You can look that up, but for those of you that are listening, please get those phone numbers in case you have not gotten a contact, because they are supposed to be a phone call. And I know that sometimes the phone calls are a little bit delayed, but they are working to give you a call. In addition to that, the holidays are coming up, as we've talked about, in Hanu. The sites will be closed during the holiday season for some dates, and we want to give you those dates so you can mark your calendars, because we are encouraging you to get tested. But you will note that they will not be open on Thanksgiving. That slide's going to come up momentarily, but they will not be open Thanksgiving Day nor the Friday after. There will also be some Christmas holiday times, Christmas Eve and Christmas Day. And then the day following Christmas, that'll be December 26th, and they will be closed during the New Year's season, 12/20/31, as well as January 1st. They will be closed, and they will be closed on ML King Day. So we want you to just keep in mind, as you're planning your regular testing, or if something comes up, these community sites will be closed on those dates, but we certainly hope that you will be mindful of that. Jot these notes down. We'll bring them back next week for you as well. So we wanted to spend a few moments, because it's been mentioned by Dr. Reynolds, and it's also been mentioned by Suzanne, that there you see those testing holiday dates. We're going to just know that these dates are going to be there, but you've been advised about vaccinations. And so we had to kind of cut Dr. Wolford short last week. So we're going to give her a little bit of time today, about 5 minutes, to talk to us about the vaccine insights that she was going to complete from last week. So Dr. Wolford, thank you for being here with us today, and give us those insights that you really want us to pay attention to. Dr. Wolford.
Thank you so much, Yvonne, for the opportunity to share again a little bit about the flu. And as you see, I'm surrounded by flu virus today, and just going to mention again how we protect ourselves against it. So remember we were talking about the vaccine and how important it is to get it because it is so effective. And vaccinations, as I mentioned, are a way of practicing self-defense. It's self-defense training for our immune system, and it helps our immune system get ready to fight the infection when it comes in contact with it. But many people don't want to take the vaccine, the flu vaccine, because they're concerned that maybe they might get the flu from the vaccine. But you in fact cannot, and I want to just emphasize that the whole virus that would cause the infection is not used in the vaccine. In fact, we use a weakened kind in the nasal spray vaccine that cannot cause disease. And we use the killed kind in the shot, and again, it cannot cause the disease. And then sometimes they use little parts of the virus, the little proteins that are on the outside, to help our body and our immune system train. But again, we cannot get the flu virus from it. So then people say to themselves, but sometimes I get the flu shot and it doesn't seem to work that well. Well, indeed, there is some variation in how well it works. And we can see by this slide that how well it protects us changes year to year. And the reason for that is that, as I'd mentioned, there are a couple different types of main types of flu virus, but there are lots of different strains of those viruses. And what the scientists have to do every year is try to guess which strains are going to be around the coming year. And so they look ahead and they look at other parts of the world that get their flu season before us. They see what strains of the virus are very common that year. And then they use that to make our vaccine for the next year, trying to guess what will be there. Sometimes they guess really well, and sometimes it's not that great. But in any case, it's always better than not being vaccinated. And so that's why we recommend that everybody get their flu vaccine so that they will be protected to some extent from getting the flu. And even if one were to get the flu, you would get a milder case and therefore less likely to end up in the hospital, and allows us to save those hospital resources for those who need it because they're critically ill, or for all the cases of COVID that we know we will have because we do not have a vaccine for COVID currently. So with that in mind, what I would like to emphasize, as all of us have today, is that because there is no vaccine for COVID, we have to engage in isolation. And just to confirm or to reiterate what that means is, if you are infected, whether you are sick or not, you need to isolate. And if you have been exposed, so we don't know whether you have it or not, then you should quarantine. And we want to be sure that you do that. Outside of that, then we can social distance and stop that spread, at least try to mitigate that spread. We can be that one who doesn't visit all with family over the holidays and finds other ways to keep socially distant while still being in relationship with others and celebrating. We're going to wash our hands as much as possible because that kills the virus. We'll avoid touching our face. I know it's hard to do, but that's what we need to, because that will stop the spread of both COVID and influenza. We are going to work as hard as we can to keep our immunity strong by eating those green leafy vegetables, getting our exercise, sleeping as much as we can. And we're going to be a hero and wear our masks, because that protects us and protects those around us. And then, as I mentioned, vaccinate. That gives us protection from the flu. And hopefully soon we'll have a vaccine that will protect us from COVID and protect us from getting ill. So with that, I am going to stop sharing my screen, and back to you, Yvonne, for any questions on that information. You're on mute.
I'm on mute. since you talked about vaccines, you helped raise that issue. So many ask, where can we get vaccines? And sometimes people are looking for vaccines that don't cost them a doctor's visit, or and they may not have resources for them. And sometimes in the community, we can support individuals who don't have the funds to pay for their vaccine. So here, coming up this week, or excuse me, next week, actually November 19th, some of our partners, as you can see down at the bottom of the flyer here, it's Be Wise Immunize. We started this campaign a few years ago, Be Wise Immunize. So when you mentioned the importance of getting the flu vaccines, we talked about flu, but there are other vaccines that are available as well. So just in a moment, pneumonia is also a really big issue during this season.
Absolutely. Yes, pneumonia is a very big issue, and there are viral pneumonias and bacterial pneumonias as well. And of course, for children, there are always the questions about the vaccines that they should be given as well. And so it's incredibly important, and you'll see behind me all of the list of the many things that children can be protected from, and adults, by getting their vaccinations. So this is an important time to not just get their flu vaccine, but all of the vaccines that can protect you from illness, so that we can keep you out of the hospital this season.
Thank you. So this is another opportunity for us to appreciate the Genesee County Health Department, because in the partnership that we have in this immunization education campaign, one of our partners is the health department, and Tanya, and I'm going to call her name out, she'll probably choke me when I see her, but Tanya Johnson makes sure that children are immunized and everybody is immunized. So at this event, the Genesee County Health Department will be there, available to do more than just the flu vaccine. If you're in need of some of those other vaccines, they will be available to assist with those. So next Thursday, November 19th, from 3 to 7 p.m. Now you see the little turkey on there, because we're getting ready for Thanksgiving, and many of us call it Turkey Day. I'm sure turkeys don't appreciate that. But at Shea Automotive, the one thing that Hurley, in partnership with Health Alliance Plan, they are going to provide a free frozen turkey to each family that comes to get their flu vaccine next week. So a little bit of an incentive. You'll have your turkey for Thanksgiving, you'll have your immunizations to keep your family healthy, and it's a drive-through, so you can also be protected from that perspective. So thank you for those insights about flu vaccinations. I want to remind you as well that there are other activities going on. I know that the Hamilton Community Health Network has a number of flu vaccinations available, opportunities available, and the Genesee Health System. They're going to have their mobile unit out as well. Now, you will see in front of you Genesee Health System Katie Baxter. And Katie Baxter has a wonderful presentation for us. We're going to talk about mental health for the holidays. But we want to make sure that she has all the time that she needs to talk about this for us next week. So I'm going to ask you, Katie, just unmute your mic. We're not going to go through all your slides today, but I want you to just give them a good tip on what we're going to talk about next week. We're going to just spin through your slides right quick and make sure that we have full time next week to talk about. So, but I want you to give them a little bit of a teaser so they'll come back next week.
Thank you, Yvonne. It's always a pleasure to be here with the community and to talk to everyone about mental health. And I can provide additional information next week. But I just want to say that a lot of us, the holidays are a very special time and a happy time, but that's not the case for everyone. So keep in mind people who have lost members of their families, or there are reminders of difficult things that happen at the holiday, that sometimes the holidays are difficult for people. We also have individuals who do not have a lot of large natural supports in their lives, and so it's also difficult for them. So I just want to remind us to think about others and find ways to support and help and reach out virtually, whatever's safe, or to volunteer and do some things to help people in the community. Next week, I'll talk a little bit about some of these areas, about preparation, how to be prepared for the holiday, how to take care of yourself during the holidays. and also how important the way we look at the world is and the attitude that we approach the world. So these are all important things. Keep in mind that mental health matters. It's very important. Our physical health is important, and we appreciate all the information about our physical health, but also our mental health is very important. So we'll talk more about these details next time. Thank you so much, and take care, everyone.
Thank you. Katie, I want to ask you just one more question. I know we're going to get into the details about this, but you said mental health matters. And all of the things that we're dealing with now, even thinking about the fact that we have to think about how we bring our families together or not bring our families together, does affect our mental health as well.
It absolutely does, because it's a very difficult time, and some people, many of us are used to celebrating in different ways with a lot of different people, and that's always a wonderful time. Keep in mind that that might not be the best avenue, but there are ways to still celebrate and reach out to people, feel safe, and feel supported as well. So we have some ideas and tips for you next week.
Thank you. Thank you. So I want to go back to something that Dr. Reynolds said, and I think Suzanne followed it up. If you're planning on having family with you, if you are planning on having families, plan now. Get them to do that quarantine, self-quarantine, and then make sure that you do all the things necessary to stay safe at home. Now, as we prepare to wrap up for today, we have some wonderful announcements for you. And I'm going to ask some of our partners of the Healthy Flint Research Coordinating Center to open up their microphones and help to chime in on this next week. I saw you, Tricia, so you can come off your microphone and talk about this with me, along with Susan Wolford and Dr. Verholden. Next week is the annual HFRCC Research Symposium. And the reason I'm asking you to come off your mics is because 35 weeks ago, we were planning for this symposium. We already had people in line. We had over 200 people that were registered. And we got that big announcements from our governor that said, cease and desist, because we were in the midst of the first real wave of the coronavirus. So tell us, and Susan, Tricia, Dr. Deborah Verholden, what's going to be happening next Friday, starting at 9 a.m.
I'm going to jump in. Thank you so much, Yvonne. Yes. So next Friday, we have the fabulous keynote speakers that we plan to have before are coming. This time we have Dr. Marjorie Innocent from the NAACP, from the National NAACP. She will be coming. We have Dr. Charlie Nelms. He will be giving us also a keynote call to action, and he will be presenting for us that morning as well. We also have a phenomenal panel that will be discussing issues so relevant to the COVID pandemic and lots of the disparities that we have seen in health. And our own Dr. Deborah Verholden will be in that panel. We have Dr. Erica Marsh, and our moderator will be Yvonne Lewis. So we look forward to that. And that same day in the afternoon, following this webinar, we're going to have a research seminar. We're going to be starting a monthly research seminar that will be happening the third Friday of every month, and we'll do the first one of those on that Friday. Tricia, what have I missed out? What do I need to add?
Oh, I didn't know if you guys had the flyer, but I did put in the chat for all the panelists and attendees. Oh, there's the flyer for the research seminar. You can register for the symposium, the COVID-19 webinar. Will be on their 36th week next week, and the research seminar, all at hfrcc.org. You don't want to miss it. It'll be amazing. The speakers, the presenters, we're giving awards. So we encourage you to register for all three events at our website.
And you mentioned the awards, Tricia. We want to thank those persons in the community who nominated people for those awards. So we didn't pick them on our own. We had recommendations and nominations. So you want to speak about that for about 20 seconds.
Sure. So I think actually the award winners are on today. So just know that people nominated both early career and champion awards and community and academic partnerships that really highlight and embody the spirit of Flint, and who have worked to impact and make changes in the community around research.
Thank you so much. So we look forward to you. Please register and be a part of next week. It's going to be a wonderful event or a series of events that'll happen next week. And so we have come to the close of our time today. It has gone by so quickly, but hopefully the information that you have gained today has been very helpful to you. Particularly, again, we want to remind those of you who are community health workers, you can get CEUs for participating in the webinar. So please make sure you connect with us to do so. And all of you, whether you're looking for CEUs or you're appreciating the information and you're here to get information for you and your family, we thank you for coming today. Please remember, at the end of this webinar, you will get a post survey. And we're asking you to complete that survey because it allows us to be sure that we're responding to the issues and concerns that you have as members of our community. We also want to remind you that you can give us a call at any time or go to our website, subscribe to our YouTube channel, and make sure that you're connected. Just stay connected with us. And the last thing I want to just remind you today, that to complete that evaluation and join us next week for a wonderful full day of activities, beginning with the Healthy Flint Research Coordinating Center Symposium, followed by this webinar, and then the first webinar or research seminar. So we look forward to you being here next week. Remember, stay safe, and we'll see you next week.